For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. For many people, parenthood can be one of the greatest joys of their lives. And as a newly expectant mother and father, there can also be many questions, from what to do when you first find out you're pregnant to what to expect when you have the baby and afterward. Today we have 3 guests here today from our new family center at St. Tammany Parish Hospital to discuss these topics and give some insight for expectant parents. Our first guest is Corey Johnson, a registered nurse in the new family center, here to discuss baby care basics and tell us a little bit about what you should do when you first find out you're pregnant. Welcome, Corey.
Good morning.
So what's the first thing you should do when you find out that you're pregnant?
So once you find out you're pregnant, you want to get in to see a doctor for mom, because we want to make sure mom's healthy. That way we have a healthy baby. And then from there, mom, we want you to pick out a pediatrician for your baby. Your pediatrician will see your baby starting out in the hospital all the way through their teenage years. And then from there, you want to start looking into the classes we offer at St. Tammany. We offer tons for mom, dad, siblings also. And then you would start getting all those supplies that you need together, diapers, wipes, a crib, a car seat. And then a big thing with your car seat is ahead of time you want to get that car seat checked. So you can do that at the state trooper's office, or our parenting center also does car seat inspections for you, because they found that most people do set their car seats up incorrectly. And then you can also start looking into hospitals like Lakeview or St. Tammany and kind of decide where you want to have your baby.
Okay, and so when you talk about purchasing supplies and that kind of thing, is that something you're doing, 2 months in, or do you wait a little? Because we're talking about when you first find out, or
Right.
Is this all taking place throughout the entire pregnancy, or do you need to get it done super quickly?
You want to do it throughout your pregnancy so that at the end you're not super stressed. So if you're going to be breastfeeding, start looking into, does your insurance company pay for your breastfeeding pump? Get your crib set up, and like I said, get your car seat and make sure that that is up to the correct standards.
Okay, and do y'all recommend, by 8 months you should have all this done, or by 7, or is there any sort of recommendation, or is it just when you feel comfortable?
I would say by 8 months you want to have it done, because what if you go into labor a few weeks early? You don't want to be scrambling and having people running to Target and buying you a car seat while you're already in the hospital waiting to go home. So just for your comfort, you want to have that done ahead of time.
Okay. So you mentioned classes.
Mm-hmm.
Can you kind of tell me what kind of classes St. Tammany offers and why those are important for expectant mothers?
One of our classes is a breastfeeding class, and it's actually taught by our lactation consultants. And it's going to give you tips on different techniques, educations that you feel comfortable when you're trying this for the first time in the hospital. We also have our baby care class, which we go over everything from as simple as changing diapers to what we're going to do throughout your delivery at the hospital. So we're going to teach you to swaddle, change those diapers, safe situations for sleeping. We'll go over car seat tests again. We cover a very broad range so that, again, you feel comfortable once you have your baby. We also offer a daddy boot camp, which is taught by actual dads. So it's just the men come in, talk about what you're concerned with, and make you feel comfortable too. We've also got the prepared childbirth classes, which is going to discuss those stages of labor. And we also have a Lamaze class, so that if you're thinking about doing that, we're going to go over those breathing and relaxation techniques.
Okay, and are these classes, I guess breastfeeding only if you're considering breastfeeding, but the rest of them, are they classes that every new mom and dad should take, or even not new moms and dads, maybe if they're on their 2nd or 3rd child?
We do. Even if it is your 2nd or 3rd, like I, for one, teach the baby care class. So I have a lot of people who, when it's their 2nd, 3rd baby, especially if it's been a few years, will come in and take the class. We also see a lot of people who are adopting babies that will come in and take our classes, just so that they kind of feel a little more comfortable about what's going to happen.
Okay, and where can people find more information about these classes?
The St. Tammany website has all these classes. The dates, times are all listed there, so you can start planning out which ones will fit into your schedule.
Okay, and earlier you mentioned choosing a hospital to deliver at. How can new moms visit the New Family Center at St. Tammany Parish Hospital, and what things does St. Tammany offer for moms?
We, on the first and third Saturday of every month, we do tours of the New Family Center from 10 until noon. All you have to do is show up. While you're there, we're going to walk you around the unit, show you around the rooms. We'll even have someone from admitting come up and kind of start helping you with that paperwork process.
Okay. And I guess can you just kind of give me a quick list of what are some of the things that St. Tammany offers that might be different or above and beyond?
Sure. Well, with us, we want you to give you the experience you want. As long as mom's healthy. So if you want to go all natural, we're here to help you. We have the birthing balls and peanuts, which help moms, go through those stages of labor. So really, it's kind of what you want. We're going to do what we can for you.
Okay, great. Well, thank you so much for being here. This is good information. I think, especially for parents who are first-time parents, I know I wouldn't know what to do.
I wouldn't know what to do if I didn't work where I work. So.
Right. So thank you so much for being here with us today.
Up next, we have Tammy Lala, a lactation consultant with the New Family Center, to talk a little bit about breastfeeding.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs for my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers, but the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Tammy Lala, a registered nurse and lactation consultant at the St. Tammany Parish Hospital New Family Center. It's great to have you here, Tammy.
Thank you for having me.
Can you first tell us what the benefits of breastfeeding are?
There's lots of benefits for mom and baby. For baby, it actually decreases the risk of childhood diabetes, leukemia, sudden infant death syndrome. And for moms, it actually decreases the risk of diabetes for her, breast and ovarian cancer, and also obesity for the baby as well.
Okay. Can you tell me why it decreases those things?
It's just the natural benefits in the breast milk that actually helps the baby. All the immunities mom has built up over her lifetime, she passes to the baby in her breast milk.
Oh, okay. So how does St. Tammany Parish Hospital help support and promote breastfeeding for new moms?
Well, first off, we have 4 international board-certified lactation consultants on staff. We're all there to help moms from the time that they come in through their delivery until they deliver the baby, and then we help support the family unit to just promote, protect, and preserve the breastfeeding by educating them, giving them knowledge, and being a support system for them while they're in the hospital. Okay. And keeping that family unit together and teaching them together gives mom a good support system to help her establish a good breastfeeding pattern and continue with that after she leaves the hospital.
Okay. Before the hospital, y'all offer a class that Corey mentioned, the art of breastfeeding.
We do. We offer that class, and it's every other month, and it's also taught by our board-certified lactation consultants. And in this class, we help teach parents just about latching the baby on, how to do hand expression of milk to help promote the full milk coming in, and to helping give them a good support system. So along with being in the hospital and helping them with breastfeeding, when they leave there, we can follow up with them with a phone call and see how they're doing. And this helps to continue with them maintaining a good breastfeeding pattern even after leaving hospital.
Okay, and so knowing all the benefits, what are some of the reasons why some moms don't breastfeed or don't want to? Is it a difficult thing to do, or
it can be challenging, but I think with the proper education, and that's why we really encourage families that decide to breastfeed or even just considering it to attend one of our classes and get all the knowledge that they need so they can be successful. Most of the time when they get this knowledge and they really process it, they really want to do it when they find out the benefits for their baby and for themselves. And having that good support system with family and friends helps them to be successful.
Okay, and that's what I was going to ask about. When you talk about support, is it just their husband or their spouse, or is it everybody, like the community?
Everyone involved in their life, and we teach them that in our breastfeeding class, to find a good support system. That is what is the number one benefit of them being successful. That's why we offer not only in the hospital, but after they leave as well, support groups for them.
Okay. Can you tell us a little bit about those support groups? And
Sure. We have, it's every Thursday, first Thursday of the month, we offer at the Parenting Center, the Community Wellness Center and Parenting Center, offers a support group for moms. Expectant moms can come, but mainly it's a really relaxed environment. It's a question and answer session, and it's facilitated by a lactation counselor there. Moms come in with their babies, and they give support really to each other and help each other with questions and answers to continue with their breastfeeding and be successful. Along with, on Fridays, we have drop-in Fridays, and that's every Friday from 1 to 2, where they can drop in and get any assistance that they need with breastfeeding from a lactation counselor at the Parenting Center as well.
okay. And do y'all have any recommendations on how long someone should breastfeed? I know it's different for everyone, but
It is, and a year ideally, 6 months to a year. At 6 months, they start introducing supplemental foods, so they're not breastfeeding as frequently, but just the benefits far outweigh anything that you can give your baby the longer you breastfeed.
okay, great. Well, thank you so much for being here, and I think this was great insight. I know I've heard a lot about breastfeeding recently, just in the community and around, on social media and things like that, so I think this is excellent education for our community.
Thank you. We've definitely seen an increase in breastfeeding in our community, and it's great to see that, and we want to continue with that support for our moms.
That's great. Well, thank you so much. Up next, we'll talk to our final guest, Sharon Moore, about maternal-infant bonding and how St. Tammany Parish Hospital supports that.
Now that St. Tammany Parish Hospital and Auctioner are working together, advanced pediatric specialists can treat your child's most complex conditions close to home, giving you the peace of mind that comes with knowing your kids are in good hands.
Welcome back to Healthy Living. Our final guest is Sharon Moore, a registered nurse and clinical coordinator at St. Tammany Parish Hospital's new Family Center. She is here to give us a little bit of information about maternal-infant bonding and what STPH does to support mothers. Welcome, Sharon.
Hi.
So I guess first tell us why maternal-infant bonding is so important, especially in the hospital.
Well, like Tammy and Corey first said, it's really about the family unit being all together and keeping them together. It improves breastfeeding rates, and just like Tammy said, breastfeeding enhances the immunity of the baby and provides benefits for both the baby and the mom. So keeping that family unit together promotes the bonding, promotes the feeding, listening to feeding cues, and really just stabilizes that family unit.
Okay, and so what does STPH do to promote and support that bonding?
Well, St. Tammany Parish Hospital, our new family center, is on the road to Baby Friendly. Baby Friendly, it's a hospital initiative. It provides evidence-based research to the hospitals to provide best practice to their patients. It is, like I said, evidence-based. It's based on research and best practice, and it gives the mothers informed choices about the care and the feeding of their baby. And it really protects the exclusivity of breastfeeding, and only because breastfeeding is the best thing for the baby.
Okay. So what are some other things that promote bonding besides breastfeeding?
Well, Baby Friendly is a 10-step program. Okay. And so it goes into education to the nurses. All of our St. Tammany nurses will be educated through the Baby Friendly process on breastfeeding and helping the family unit bond and how to take care of the baby outside of the hospital, where we have to take 20 hours of continuing education, which is a lot for nurses. And all of our nurses will be educated on those Baby Friendly initiatives. And then also goes into how to keep breastfeeding the same in the hospital and afterwards, and exclusive breastfeeding. So it goes into also skin to skin to establish that first bonding experience. And what skin to skin is, right after delivery, the baby is placed with a diaper naked to the mother's chest, and we heard it once called heart to heart, which is kind of a cute way to remember. The baby's heart is primarily placed on the mother's heart, and it's no clothing in between, and there may be a warm blanket, but that's skin to skin, and that will promote the stabilization of the baby's heart rate, respirations, glucose, and help the baby transition into that extrauterine life. Right out of the delivery, the baby is placed there, and you can see a huge change in the baby's demeanor when it's placed skin to skin. You can see the baby start looking around at the mother because the baby can smell the mom, and mom is in. Their heart rate drops, and she calms down, and everything is stabilized. It's amazing. So, and St. Tammany does that, and not only just for our vaginal delivery mothers, but for our cesarean as well. So the baby is placed as close to the mother's face in the C-section, but after, in recovery, the baby never leaves the mom's side because. Let's face it, she's waited 9-10 months, maybe even years for that moment to meet her baby. So once the baby is delivered, there is a support person that stays there, and the baby stays with that support person when mom is being cleaned up and moved to her regular bed. And then she goes to recovery, and the baby can be placed skin to skin at that time. So the most important thing to remember is that we're keeping the family unit together. There's no separation from mom to baby. Baby isn't going to the nursery and listening to all of the other babies crying in the nursery, or listening to the nurses in the nursery, or smelling those different nurses. The baby is with the mom and the dad the entire time. So I just think that's it's come a long way. That's how it used to be a long time ago.
Right, that's what I was going to ask you, if this is like a new concept.
No, it used to be like that a long time ago, and then it was just kind of lost, and we're bringing it back because that's what it should be. That's the way it should be.
Okay. So you talked a little bit about the baby and mom staying together. Mm-hmm. What is rooming in?
So same thing. It's keeping that family unit together, rooming in. So we do have a nursery. It's beautiful. There's a big windows and stuff, and it's mainly for the visitors. But that's not who it should be about. It should be about the family and the baby, and this new baby, and helping this new baby come into the world and know their mom and dad. So stay with the family. The mom is also needing to learn the feeding cues. Maybe it's the first mom, like Corey was talking about, how she talks to the new mothers and even older mothers about the education on how to take care of a baby. But they don't know when to feed the baby. They say, okay, so I'll feed it every 2 to 3 hours. No, you feed it when the baby shows signs of feeding cues. And that's what we like to say. And that way, the baby will show the feeding cues. The mom will latch the baby to the breast and simulate the breast. and get that milk production. If we just wait every 2 to 3 hours, that milk production's not going to come in as fast as it could if we just listen to the feeding cues. So keeping the baby rooming in close to the mom, being able to hear those feeding cues. Research shows, because Baby Friendly is all about research shows that if the baby is kept near the mom, the mom gets more rest. So really? A lot of people say, oh, I'm so tired, let me bring the baby to the nursery. That's not the case. If you keep your baby close, you will get more rest. Research, I mean, wow. It's all based on research. So another thing, rooming in, there's a lot of stuff to do before you go home. There's pictures, there's blood work that we have to do for the baby. So we want to make sure that all of that is done at the bedside. Even the exams done by the pediatrician. We want the moms to ask the pediatricians if the exams can be at the bedside. That way, you know, it's like that when they go to the pediatrician's office. So why does the pediatrician have to bring the baby to the nursery to be examined? The obstetrician examines the mom in the room. I mean, everything can happen in the room. So why separate that? You see what I'm saying? So we have gone and talked to the pediatricians, obstetricians, all the lab, dietary, everybody, housekeeping, everybody, to kind of get into this baby-friendly mode and keep the baby and mom together. And by doing that, everything happens in the room. Your bath after delivery happens in the room. Recovery for a C-section, we don't recover in the recovering room anymore. We bring the mom back to her private room and recover in the room, which is fantastic. And she could be with the baby and the support person. So, you know, again, we're thinking about the family. We want the best experience for the family, and St. Tammany is on that pathway.
Okay, and can you talk a little bit about visitors and quiet time for
Sure.
the mom and the baby and the family?
Sure. So, just like I said, the mom will have to listen to feeding cues. So if the baby is waking up every hour at night feeding, the mom is going to be very tired. So if there's a lot of visitors during the day, the visitors aren't going to be coming at night. Right. The visitors will be coming during the day. So the mom is going to be so tired if she's having to stay up at night to feed the baby on the feeding cues and to entertain the visitors while they're there. Now look, my sister just had a baby, my sister-in-law just had a baby, and I wanted to see the baby as well. But see the baby, visit the baby, and then, you know, be respectful and let the family rest if you see that the mom is tired or if she said that she stayed up all night. St. Tammany has designed quiet time hours, and that's from 1:30 p.m. to 3:30 p.m. It's 2 hours. It's a good nap time, and it's right after lunch. And the nurses don't come in and bother you and take vital signs, and dietary doesn't come in unless you order, you know, a menu. Housekeeping doesn't come in to, you know, change your garbage and all that kind of stuff. It allows the mom and baby to rest for 2 hours uninterrupted, no visitors, and the lights go dim in the hallway, and it's just a very relaxation time for the mom and baby. And now, if the mom needs it, if the mom it calls out and needs some help or whatever, obviously the nurses will go in there. But it's really just to be mindful of the mom's rest, the mom and baby's rest. So that's why we do it, and it's not for us to sit back, but it's for mom and baby to be able to rest because they're going to be up all night.
Right, and to kind of encourage the family, give them some time to
Absolutely.
sleep during the day.
Yeah, come before or after. Mm-hmm. I mean, it's only 2 hours out of a 12-hour daylight period.
Right.
You know, 2 hours and come before or after. Maybe bring them lunch and then and let them have a little siesta.
Awesome. Well, thank you so much. That's awesome
welcome.
information, and it's a lot, and I think it's great that y'all are moving toward baby friendly and
Right.
trying to do what's best for the family unit as a whole.
Absolutely, absolutely.
I'd like to thank Corey, Tammy, and Sharon for being here today and giving us some great information for expectant and new parents. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.